Have you ever thought about the impact of diseases that are often overlooked by mainstream health discourse? Imagine for a moment the plight of millions of people around the world suffering from what we call neglected tropical diseases. Neglected tropical diseases, or NTDs, are a group of diverse health conditions or pathogens, including viruses, bacteria, parasites, fungi, and toxins that collectively affect more than 1 billion people globally. While most STDs are concentrated in tropical areas of Asia and Africa, many can be found all over the world, including wealthy nations like the United States. Why are these diseases neglected despite the number of people they affect? Firstly, these diseases are predominantly prevalent in impoverished regions where access to clean water, sanitation, and healthcare is limited. They are also prevalent in conflict zones and difficult to reach areas. Secondly, they are often not a point of discussion on global health agendas as they are ignored by funding bodies. The World Health Organization has recognized 21 NTDs. These include Buruli ulcer, Chagas disease, dengue, chikungunya, dracunculiasis, echinococcosis, foodborne dermatitis, African sleeping sickness, leishmaniasis, leprosy, lymphatic filariasis, mycetoma, onchocerciasis, rabies, scabies, schistosomiasis, soil-transmitted helminth, snakebite envenoming, teniasis and cysticercosis, trachoma, and yields. These diseases may not gather as much attention as other health threats, but their impact is just as severe, if not more so. In fact, the burden these diseases place on communities is enormous. The World Health Organization has estimated that these diseases cause tens of thousands of deaths each year, but the impact extends beyond mere mortality. These diseases can cause long-term physical impairment, which can impact a person's ability to work, go to school, or even carry out basic daily activities. Consider this. The economic burden of entities is estimated to be billions of dollars each year. This includes direct medical costs and lost productivity due to illness. But there is a glimmer of hope. Over the past decades, significant progress has been made in controlling and, in some cases, eliminating these diseases. This has been made possible through improved access to effective treatment and preventive measures. However, the fight is far from over. More needs to be done to raise awareness about these diseases and to improve access to treatment and invest in research to develop new therapies. If you're new to this channel, please subscribe, like, and hit the notification bell to stay informed. Health is wealth, and information is key to long life and prosperity. WHO had recommended 5 core strategic interventions to accelerate the prevention, control, elimination, and eradication of neglected tropical diseases. These include innovation and intensified disease management,
Vector control, veterinary public health,
preventive chemotherapy, and the provision of safe water, sanitation, and hygiene. In summary, neglected tropical diseases are a serious health issue affecting over 1 billion people globally. These cause significant morbidity and mortality and place a huge economic burden on some of the world's most impoverished communities. However, with continued efforts in awareness, treatment, and research, we can hope to see a world where NTDs are no longer neglected, but rather actively addressed and ultimately eradicated. Remember, every life matters, and every disease deserves attention. Together, we can make a difference. Thank you for watching. This is Street Science. One story, one street at a time.